Hi, I'm Dr. Martin Rutherford. I am a chiropractor since 1979, and as a result of myself becoming ill many years ago and ultimately searching for results, finding them in functional medicine and functional neurology, I am now a certified functional medicine practitioner. And this is Dr.
Randall Gates. I'm a board certified chiropractic neurologist as well as being a chiropractor.
We work together. We have melded two disciplines in the functional world. One discipline being functional neurology, which addresses the brain and the nervous system and basically everything which controls everything would be a better way of putting it. And I think is the most underappreciated aspect of chronic pain. And along with functional medicine, which basically addresses everything else. The endocrinology of the body, the hormones, the gut problems, all that type of stuff, usually without medication, although we do work in an integrated environment. And as a result of starting off a chronic pain practice with fibromyalgia, that ultimately morphed into peripheral neuropathy, that ultimately morphed into dizziness, vertigo, balance, restless leg syndrome, and I won't even go into all the stuff that we treat. We treat chronic pain. And there are so many aspects to treating chronic pain. We're going to talk about one of my favorite ones today, which is hormone replacement therapy, what you need to know. I don't know if Dr. Gates picks all these subjects and busts his butt to make sure that they're well covered and that you have a lot of peer-reviewed references
yes.
to understand that we're not just making all this stuff up. Furthermore, what we talk to you about is what we see in practice. If we do some practice, it works, you hear about it. If we do some practice, it doesn't work, you hear about it. This is one of my favorite subjects, and one of my biggest buttons is hormone replacement therapy, because in the long term, there's not many good things that can happen from hormone replacement therapy.
I know what you mean.
We're going to talk about that a little bit more definitively as to when it's appropriate and when it is good. But in the end, about three things happen when hormone replacement therapy occurs. You get the hormone. We're going to talk about estrogen today and hormone replacement therapy in menopause. You get the hormone and it tells your ovaries to kick back. Nothing you need to do. The ovaries start to kind of atrophy and stop working. There's a little feedback mechanism to your brain that kind of starts to get interfered with. The part of your brain that tells you that your hormones are low and that you need to make more kind of kicks back into the easy chair and says, well, okay, guess I don't have to do anything anymore. And eventually that mechanism can break. I think what we're going to talk about today, based on Dr. Gates's outline, is all the reasons that should be the very last thing that you try, with some exceptions, which we'll talk about. I think hormone replacement therapy is creating a lot of problems in this country, especially in the areas, and this is very controversial because, as we were talking about, we just have a friend who's going into hormone replacement therapy as a primary issue, okay? And he knows better, and if you're watching me, you know who you are. And we're going to make the point that you shouldn't do that you should keep doing what you know you should be doing. And we're going to make that point very heavily right now, because I think on doing the intakes, on doing the consults, on doing the histories, on doing the exams, which I'm a big part of that. I think this is a big problem.
It is.
A huge problem, yeah. A huge problem in this country. Everything in this country becomes like
it's a pill for everything.
Like a pill for everything. And everything becomes, I'm not anti-capitalist by any stretch of imagination, okay? But I'm pro-capitalism with ethics, kind of like do what's right and put out a good service, attract people, give them, get them well, and make a decent living. But I'm not for taking one thing like a pill, whether it's a hormone replacement therapy or whether it's a vitamin, and creating an entire industry around it for everybody, because that's not right. And we see that day in and day out in our patients, because we have the patients who do better with less supplements and less drugs. And who doesn't do better with less drugs? So let's talk about hormone replacement therapy. Now I got that out of my system. Great. And believe me, I'm holding it down here. This is a subject that really ticks me off, because people know better. The doctors know better. The industry knows better. The drug companies know better. And we're going to show you that they know better. because it's in the literature.
Right.
And the Endocrine Society webpage, I don't know if this is the Endocrine Society webpage, but it's even on there saying the way it's being done is not the way to do it. So let's talk about menopause, which I hear about every day. I went through menopause and that's why I have all these problems. Okay, not to make fun. I know I'm a guy, but hopefully you're going to see why I said it that way, because man, that is so the wrong target. That is so the wrong target for all of those symptoms. This should be a major eye opener for all women who are going through menopause, have gone through menopause, and hopefully is going to be a preventative talk for the people who are going to go through menopause, like our today producer sitting over there. So let's talk about menopause.
So menopause happens when a female's ovaries start to kind of wind down and she's not making enough of the estrogen and progesterone derivatives in essence for her to have menstrual cycles on a normal basis. Typically that can be associated with a myriad of symptoms, hot flashes being the number one symptom that bothers most menopausal or perimenopausal females. Then we also have night sweats, we can have depression, we can have changes in mood. They call it mood dysphoria, basically changes in the way the sleep patterns are occurring. And there can also be some cardiovascular disease associations there, as well as dementia when these hormones start going down.
So the key is the ovaries are winding down.
They're winding down.
But they're still
there and they're still making some hormones. Yes, exactly.
Okay. And the ovaries are not the only place that hormones are made. They
are
the key. It is shocking to a lot of the patients when I tell them that they haven't stopped making hormones.
They just think it's completely gone.
They think it's done.
Yeah.
I'm over. I've lost all my hormones. There's nothing else that I can do except replace them.
Right.
And that's it. And kind of nature's kind of smarter than that. Nature's kind of like, doesn't put you through menopause so you can be miserable for the rest of your life. Nature knows how much hormones you need once you don't need to make babies.
Mm-hmm.
And we're going to kind of make that point. He didn't know we were going to make that point, but we're going to make that point.
I'm glad you.
We're going to make that point because that's kind of how it flows. And we've been, and the women who come in here and I do the they are convinced. They have gone to menopause. Everything that happens after that is going through menopause. That is so off. I mean, it's mind-numbing how off it is. I don't mean to get over the top on this, but I hear this all the time, and I have to spend a lot of time convincing people that that isn't the way that it is. So
exactly. And as we kind of alluded to there, the adrenal glands, which are the stress glands, so to speak, they sit on top of our kidneys.
This is the key, people.
They make stress hormones. They do make other hormones that help to keep your blood volume at a certain level. Let's say you chop off an arm, your adrenal glands go into overdrive to make sure that you save all the blood in your body that you possibly can. The adrenal glands also make sex hormones, and the importance of the adrenal sex hormones goes way up when somebody goes through menopause, because now as the ovaries wind down, and as Dr. Rutherford said, the ovaries are still making hormones, just not as much as you're used to the rest
menopause
of your life.
is very stressful on the system.
Exactly.
And the ovaries and the adrenals are known as the stress glands, even though they control your blood sugar, they make the precursors to your female hormone. I look at them more as the balance glands.
Right. And we'll discuss why, for a lot of you, the adrenals cannot balance the situation. We're going to get to that.
For a lot of you in the alternative healthcare profession, I don't mean to be like condescending or anything, but you have been taught that the adrenals, it's like, you can't fix the adrenals, you can't fix anything. I'm telling you, most of the time, they're the wrong target. There are things way above the adrenals, as you're going to find out today, that need to be fixed, that'll synchronize those amazingly synchronizable adrenals that will then start taking care of some of those problems that you have because you went through menopause and life is now over. Because it ain't over. So hormone therapy. I mean, this is the topic. Hormone replacement therapy. Let's get to it and why women are so ecstatic about it when they come in the office, because they took their hormones. They went, I took my hormones and I feel better.
Right, exactly. So we have this concept that once we lose something, we just need to replace it in the body.
And this is a sensitive subject for us because we're guys.
Yeah.
But hopefully by the end of this, you're not going to be sitting there going, well, you're guys, you don't know what you're talking about.
Because most of our patients are female.
Or women.
And are females. And so hormone replacement therapy works. at a glance, so to speak, because your estrogen and progesterone levels have gone down, and now your hormone replacement therapy doctor, which may be an anti-aging physician, it may be your OBGYN, they're giving you these hormones, and all of a sudden your hormone levels are back up. And
according to your blood tests.
Yes, and maybe
we should get into that.
Your hot flashes are now going away, your depression is going away, you're able to sleep better, life is good, you are happy.
So the concept is your hormone tank is emptying, and most people think it's empty, and then we fill it up with hormones. Right?
Life is good, and you're running through a meadow now, and it's like a pharmaceutical commercial.
Yeah.
Where
has nothing to do with anything else, just the empty hormone tank.
Right.
Yeah. That's not the way it is.
So then in 2002, a big study came out. It's called the Women's Health Initiative. And there's also one called the Heart and Estrogen Progesterone Study, where at that time, a lot of women were on hormone replacement therapy because their hormone tank was low, as you're saying. And in that series of events, they started noticing that a lot of women who were on hormone replacement therapy had breast cancer. And they also had a much increased chance of developing strokes. Well, yes. So at that point, most medical physicians put the brakes on using hormone replacement therapy. So all of a sudden, everybody pulled back, because the one thing doctors don't want to have occur out of anything is getting sued.
I was going to say lawsuits.
So getting sued
not patients
is
not getting
always
better.
above
Lawsuits.
Patient care. So we're being a little facetious there, but for most doctors, I mean, that is kind of what governs the thought process. Yeah. At least that's how doctors are taught.
For a lot of doctors, for sure.
Yeah. So in essence, everybody pulled the brakes on the hormone replacement therapy. Since then, a lot of studies have been exploring how maybe hormone replacement therapy could be used in a different fashion that may be a little more safe or efficacious. It's still an easy model.
Because it's easy. Go in, the hormone tank is low. Woo, I took your test, and your test says your hormone tank is low. I'm going to give you estrogen, horse pee, or whatever it is we're going to give you.
Right. Yeah.
Okay. And it's like, well, there's doctoring.
And
I'm sorry, I'm on this today because this is disastrous for women. Disastrous. In long term, it is disastrous, and it's like part of our culture. Right. I mean, you go down to Los Angeles. I was down there a couple of years ago. I mean, there's like a hormone replacement therapy, anti-aging group on every corner, it seems like.
Right.
San Diego, same thing. I mean, it's like, wow. So I don't know about the rest of the country, but.
Well, we have a vain society, and everybody wants to feel young. They want to look young. They want to have.
He didn't say that. We do.
And
it's pop culture now. Everybody's got to look like a Barbie doll.
You know, well into their 70s.
It's unhealthy, people. It's unhealthy.
Yeah, we went to the anti-aging conference, just so all of you know, in December in Las Vegas.
5,000, 6,000 doctors.
Yeah, it was a lot of doctors. It was a fantastic conference.
We mostly went to the chronic pain, autoimmune type of stuff. But that's anti-aging. People have said we should call what we do anti-aging because they get better, they lose weight, they look younger, their skin looks better, their hair looks nice. But that's what happens when your body starts working again. When you calm down all the stuff, your hormones start working a lot of the time.
Exactly.
Like most of the time.
Right.
Like most of the time.
And that's a really interesting point
that
I kind of want to go on, just because anti-aging medicine, we really credit the developers of anti-aging medicine as two medical doctors, very, very bright guys. And these guys were, in essence, the pioneers who walked out on a limb saying, you know, people are getting older. We need to help people to live as well as they can into their later years with vitality. We need to look at diet, we need to look at nutrition, but they also looked at things like hormones. So today we're going to be kind of giving our stance on hormone replacement therapy.
Okay.
And that we don't really think it's necessary for most of you because other things can be done to prevent you needing hormone replacement therapy.
Are you going to talk about those other things?
Yeah, we will. We'll go into all
Okay, I didn't
that.
see that in here.
That's okay. I'm kind of going off on a tangent.
Okay.
But in essence, with the anti-aging medicine movement, you know, they were the ones that really started pushing things after 2002. Because at 2002, after the Women's Health Initiative, and we saw the increased risk of breast cancer and the increased risk of stroke go up with hormone replacement therapy, this anti-aging movement said, well, let's just figure out how we can do this in a better way, in essence.
In a more profitable way.
And there's that too.
Hormone replacement therapy and hormone problems in general are the bottom of the barrel of physiology. We have worked on a paradigm and a logarithm, whatever you want to call it, a method, an organized method of going at chronic pain. We got the basic structure of this from a gentleman named Dr. Dhea, who's what's going on here? Somebody's making noise. So whose main expertise is functional medicine and has made his name with an initial tome book on thyroid replacement therapy and why you don't need it most of the time. But it's mostly about Hashimoto's, and it's called Why Do I Still Have Thyroid Symptoms When My Blood Tests Are Normal? You think you have a thyroid problem? Get that book. It's 4 years old and it's still very pertinent. But although many things are being played with as what was when someone came in with all of these symptoms, hot flashes, night sweats, mood changes, all that type of stuff. Although there were a lot of different ideas on what might be the conditions to address above it, anemias, blood sugars, whatever, it was pretty much understood at that time that these symptoms were secondary to everything that was going on above it. So in our paradigm, we have a 17-page history, and in the middle of that, or close to the end of that 17-page history, is Dr. Karazian's 2 pages. Or I guess 3 pages. I guess he did the neurotransmitter assessment for him. And that's kind of a flow as to how you would treat a chronic patient. I actually think I would change it a teeny bit, but having said that, it's pretty accurate. And so listed in order of symptoms that you would check off in this history would be large colon symptoms, small intestinal symptoms, both small intestines, then stomach problems, then pancreatic problems, then gallbladder, then liver, then blood sugar, then adrenals. By the way, for you adrenal maniacs, you'll notice that I've listed that it's down here. Okay, then adrenals. Then he has electrolytes. I would almost kind of put that down at the bottom with the female. I might even put it below. Well, in that area. Yeah. And then thyroid. And if you want to know why thyroid's all the way at the bottom, look at our Hashimoto's thyroid stuff. And then all of the symptoms of male and female menopause. That's kind of the way it works, folks, is really the crux of what you're going to go through here is that you can't even begin to get your menopausal or postmenopausal symptoms fixed long-term without drugs or with minimal drugs until you handle those others, because all of that physiology is changing the way that those hormones are made and modulated. Yeah?
Yes.
Okay.
Yes.
I'm on it.
You are on it.
Again, this is such a pet peeve with me. I just can't even tell you. It just drives me crazy, as you can tell. If you've watched any of our other things, I don't get this animated that often, but this is almost like criminal to me. It is. So,
well, that's good. I'm glad you're so excited.
So where do we want to go?
Well, let's talk about estrogen and progesterone. So basically, the estrogen-progesterone combination appears to be the most deadly combination of hormone replacement therapy. The current studies are showing basically that you should be on estrogen only. You can maybe be on some testosterone, but you shouldn't be on estrogen and progesterone at the same time. Now, other studies are looking at using estrogen with estrogen blockers to decrease the risk of cancer. As you and I have talked about extensively, a lot of
so we can keep selling them that estrogen.
You got it. Exactly. And then after 2002,
I'm not being a jerk here, people. You need to know the reality of why this is happening.
Oh yeah, it's a market
for sure. A market.
And so then after 2002, they started saying, well, let's just do the hormone replacement therapy for 3 months. And we don't want to do it for any longer than that. Now they're discussing using transdermal deliveries of the hormones. So where you rub on your estrogen and progesterone, possibly that will be safer than you taking them orally. I attached an article, hopefully it's attached today, about estrogen and progesterone being used in terms of bioidentical hormones. So
why would that be safer? Why would transdermal be safer? I would think it would deliver it more powerfully.
You would think so too, but they're thinking that maybe it's not being processed in the liver, so there are fewer
Oh, okay.
thromboembolic
Got it.
consequences
Got it.
because of that.
Okay.
And now the whole rage is bioidentical hormones, which are quote unquote more natural. But the long-term studies on those are lacking as well. And frankly, the long-term studies on all of this is lacking. So we know that estrogen and progesterone together is a deadly combination, but we don't really have the studies of 20 years or 30 years from just taking estrogen with an estrogen blocker. We don't have the safety profile of that yet.
But that 2002 Women's Health Initiative and heart and estrogen, if that one wasn't discontinued, there was another one that the study was actually discontinued.
Right.
And I'm pretty sure, at least if it's not on the Endocrine Society face page, whatever we call that page. I'm not a big computer guy, interestingly enough.
The webpage, yeah.
The webpage, it was on there for many years, saying don't take estrogen for more than 6 weeks or 12 weeks or 3 months. Take it at the lowest dose. Take a break. See if you need it. Blah blah. I mean, who knows? It might still be on there, but the study is still there, and the studies that have been done, although they have not been long term, are all bad. There's just not. I don't know studies that are going, whoa, take hormone replacement therapy for the rest of your life.
Right. Yeah, they talk about it as a short-term solution in most instances.
Short-term solution. For those of you who've been taking it for 10, 15, and 20 years, the lady came in yesterday, she said, oh, great, I've been taking birth control for 20 years.
Right. I mean, we've seen 3 young females who have been on birth control who have had strokes.
Yeah.
Because we treat a lot of neurological diseases. So they had vertebral artery strokes secondary to being on birth control. So now let's get into the adrenals. Let's go into the real mechanism.
This is where, now for all the people who are going to say, you just got done saying the adrenals wasn't where it's at.
Yeah, exactly. So relative to the adrenals, we have a mechanism in our brain that's basically we send signals down from the brain through the spinal cord down to the adrenal glands that sit on top of the kidneys. The adrenal glands make a variety of hormones. They make cortisol, as we talked about. They make aldosterone. They make progesterone. They make DHEA. Now, as your ovaries start to shut down, or let's say they're starting to wind down, even though they're still making hormones, your body is becoming more dependent on the adrenal glands making your sex hormones. But so many of you go through menopause and you're also under severe stress.
Bingo.
Severe chronic stress. And you probably have some blood sugar abnormalities as well. You may have some inflammation in your system. You may have some small intestinal problems.
You have a thyroid problem.
You may have a thyroid problem
that's not being treated right.
And so all these compounded together result in your physiology not being as good as it could be. And so now the adrenals can't make the appropriate amounts of hormones that your body needs it to.
So when you're going through menopause and you're having all these symptoms and your neighbor's not, it's because you are a poor host. It's because you have some combination of everything that Dr. Gates said, and maybe more, and they don't. And that's...
Yeah, that's why some women go through menopause and they're very healthy and they have no issues, and others are just a complete wreck, so to speak. So then the brain tries to get the adrenal glands to work harder. So in this scenario where maybe you have blood sugar problems, you have a thyroid issue, and you're going through perimenopause or menopause, the brain tries to get the adrenal glands to go into activate mode. However, in our clinical experience, many of you have poor adrenal function. So as a result of that, the brain starts sending all of these fight-flight signals throughout your body. And that is actually the reason why you develop hot flashes. A hot flash is actually a vascular response. In essence, it is a fight-flight mechanism to the blood vessels of your body, and that's why you get the flushing sensation. You get very hot, you start sweating. Many of you have heard fight-flight. That's where you see like a grizzly bear and your body prepares you to fight as hard as you can or run as fast as you can. The opposite end of the spectrum is a rest and digest response, which is where you're sleeping after you've had a large steak dinner. So the body tries to push you into fight-flight mode to get your adrenals to make more sex hormones. But if your adrenals are already fatigued, they can't do that.
Yeah. And I would say relative to the opposite, and I don't want to give them the impression that that should be balanced between the fight, flight, and the rest and digest. We should be calm and rested and digested most of the time. And we should only go into fight, flight in emergency. And that should be for a couple of minutes, and then it should shut down. Most of you who are going through these symptoms are pretty much in it 24 hours a day based on our observation. A lot of you have suffered. These are a lot of the people who've suffered traumatic stresses in their lifetime, long-term stresses. Same thing when we go back to our fibromyalgia patients. A lot of them have had situations in their past that have verbal abuse, physical abuse, sexual abuse, those times. And with something has caused your fight flight mechanism to which is only supposed to be in occurrence for short periods of time, minutes, maybe 30 minutes. Dr. Gates discusses that under unusual circumstances, maybe 30 days, but not for a lifetime. And that's happening to you for whatever reason. Okay, whatever reason set that off and it didn't stop. That's what's happening to you. And it's a lot of you will come in and say, I went and got a massage or I got an adjustment and my menstrual cramps went away. And what that did was it basically interfered with the stress that was going to that area, it calmed your muscular situation down there, it interfered with that fight flight mechanism temporarily. And so some of you go to chiropractors and get adjusted a couple of days. Great thing to do. But if you have to do that, there's something else happening. And these are the things that are happening.
Exactly. Exactly. And then the adrenal glands, as I discussed, make something called DHEA. And what we're now finding in postmenopausal females is that DHEA can convert to estrogen and progesterone. So that's the pivotal piece. And they're even discussing maybe we should be using DHEA. If you want to supplement with something, they're looking at using DHEA as a supplement. It's obviously a little more natural. It's over the counter. It's pretty safe overall. And that can help a lot of people with their hot flashes and their night sweats and things of that nature.
Yeah, the adrenal glands make the precursors. So the adrenal glands make the precursing chemicals that make your estrogen and your progesterone. And I think a significant point, and Dr. Gates went over this, but I want to make a point of this because for those of you who are younger going through menopause or menopausal type stuff, you're definitely in a stress mechanism. Yeah. And here's why. Because the stress hormones that are put out by the adrenal gland are put out, let's say just generally, they're stress hormones. They're put out to try to handle the stress in the body, calm your body down, keep it normal. Well, those same hormones are the hormones that are supposed to be making your estrogen and your progesterone, the precursors to it. They combine with other things and then you make estrogen. Well, if you're using all of those hormones because you're stressed out of your mind 24 hours a day to handle stress, you're not using them to make your hormones. And now you have hot flashes, night sweats, mood changes, insomnia, depression, brain fog, short-term memory loss, and you come in here on hormone replacement therapy for the last 5 years, which is really helping you a lot, and you're 23 years old. That is crazy, okay? But it's that stress mechanism. Right. It really, really comes down to these adrenals.
It really does.
It's like I told somebody that the other day, and she basically almost attacked me. It was 2 days ago. I said, I'm gonna tell you all that stuff is and this poor gal, oh my God, this gal's, she's had a stressed life for a long time. And she just about, of course, she just about came across the Dhea because she has a very short temper from being so stressed. But she finally started to get it. She finally started to go, oh my God, you're right. Every time I would have this, I would get these symptoms. And then when I would calm down, they'd kind of go away. But since I've been taking the hormone replacement therapy, that has been kind of like blurred. And I really, now that you're talking about it, when I go back before that, I really noticed that it really had a lot to do with it. And people think that's normal. I mean, this is the stuff I want to, the people that, well, I got stressed and I got all these symptoms. Yeah, well,
right.
That's not good. Well, it's the stress. As long as I remove the stress, then it's there. Yeah, but if you're that stressed, if your brain, I'm talking about this fight flight mechanism, if your brain's going like that, it's really hard for you to remove it on your own, unless you're like a long distance runner or you meditate for 2 hours a day or whatever.
Yeah, exactly. Yeah, I would say most people can't get themselves out of that stressful state in our experience.
No, that's why they come here.
Right.
Or wherever they go.
And with each broadcast, we always recommend the book Why Zebras Don't Get Ulcers by Robert Sapolsky. It's the world's
I'm finally reading
best book on stress.
He's read it.
Yes.
It's an awesome book. It's an awesome book. Awesome. Get it.
To help you explain
if you have stress,
really going on.
Get that book.
Yeah.
It's a little lengthy.
It is. It's detailed.
But it's detailed. But I'll tell you what, you'll get it. It'll make you feel better. It'll make you feel like you're not crazy.
Yeah.
The adrenals, DHEA. So basically what's happening is everything is going wrong and the female hormones are not being made, or they're not being made in a balanced fashion.
Right. And they're also showing with hot flashes as an example, blood sugar alterations actually induce hot flashes too. So just know that as we were talking about the gut, we were talking about inflammation, we were talking about blood sugar. In essence, all these things have to be normal for your adrenals to do their job correctly. But if you're eating a Twinkie for breakfast and you're having Starbucks, you know, at 10 a.m. and then you don't eat dinner until 7 p.m., just know that's really, really hard on your adrenal glands. And it's hard on your blood sugar. Your adrenal glands have to sustain blood sugar at a normal level. So if you're not eating 6 meals a day, your adrenals are having to go into overdrive, making cortisol in order to keep your blood sugar normal. But again, as Dr. Rutherford said, when you're making a ton of cortisol because of your poor dietary habits or because you're under so much stress, as a result of that, you won't make the precursors to your estrogen and progesterone.
And every time you get one of those ups and downs from blood sugar, you fall asleep after a meal, or you get irritable and shaky, that causes a stress shock to the adrenal glands.
Absolutely.
There's probably was a time when people didn't need to eat six meals a day to keep their blood sugar
probably not. Yeah, you're
normalized. But right now, we live in a pretty stressed out society. I mean, our brains are getting pounded 24 hours a day. And who thought we would be talking about that relative to your hot flashes and stuff? But hopefully, as you're watching this, you're starting to look back at your world and go, you know what? That's when it started. I had a gal yesterday. Gal came in for digestive bowel problems yesterday. And it started with a knot in her stomach and a cramp when she was 12. Now look, when you get, and then she started having abnormal, she had already started menstrual, then she started getting abnormal menstrual cycles at 12. They did all the testing, no pathology, no tumors, no nothing. Well, you just have abnormal menstrual. So once we started digging, she got it at 13. Her dad died when she was 12.
Wow.
And they were very close. And boom, at 13, everything went south. And for her, it was that stress mechanism. If you watch some of our other videos, I probably think you'll do is go to watch our video on stress. Yeah. And I think it will also explain that a lot more, but it's a big deal. What we're finding more and more is that most of the conditions that come in here have two components. And one is a stress mechanism and the other is an autoimmune component. Now, I'm not saying everybody's got that. I'm saying the ones that show up to our office, that's generally what they have. Nobody's been able to figure out what's wrong with them. They got a zillion exercises. And people consider this so normal. Hot flashes, night sweats, mood change, especially if they're in or past menopause. They don't even mention it most of the time. It's like, oh, well, I went through menopause. This is something I have to live with. And there, a lot of them are kind of not really, they're kind of disbelievers when I say, well, look, we're gonna handle all this. And at the end, they'll say, oh, by the way, all these symptoms down here, they're probably gonna move from like, I have them all the time to maybe I occasionally get them to mild, or maybe they'll actually go away. And they're like, really? That can happen? That can happen? You mean my body could actually get better? I mean, this is where we're at. We're at like, my body can't get better. Like somebody has like flown over this country from outer space and sprinkled sickness pixie dust on us. And all of a sudden we all have these autoimmune problems and we have all these female problems and nobody can get better because the doctor told me. The doctor told me, took out half of my gut. There's another person I talked to 3 days ago. 4 days ago, the doctor took out half of my gut and he just told me I got to live with it. You know, I'm just going to be this way forever. I just keep getting adhesions. She's got an autoimmune problem. You calm down her immune system, she's going to stop getting adhesions. This is what this, and this hormone replacement therapy is some of the biggest violators of that, in my opinion. So I'm probably going to get in trouble for this, but screw it.
I love it.
Do you?
Yeah,
He looks nervous, doesn't he?
No, I don't. You're on it today. So,
well, this is something that I listen to virtually with every female patient over the age, I'm telling you, like 15 that comes in, because all of our patients have what caused these problems. And they don't even mention it. It's not even like on their radar. It's not even like, I'm not here for that. I'm here for all this other stuff.
Right.
So what else?
I think that's it.
So so the mechanism is basically, if you have these problems, you probably have a stress related problem at the very least. You have a lot of other things. Doug Gates I don't even think he touched all the things that could be affecting your adrenal glands and causing them to not be able to make the precursors that are causing your hormones to not work right. Certainly there are pathologies out there. Certainly, oh, you know what? What about women who have their uterus taken out and their ovaries taken out?
Okay, well, the adrenal glands should still be able to make a certain amount of hormone in those situations.
I agree, but I want them to know that, because
Right.
when I tell people that, they like my endocrinologist says that's not true.
Right.
Yeah, that's your endocrinologist is giving you hormone replacement therapy.
Yeah, they should be able to make a certain amount of hormones.
And you don't only make estrogen hormone in your ovaries. So there are other areas of the body that will make small amounts of estrogen. But since at that point you don't need to make a kid, you don't have a uterus, you don't have ovaries, your body can adjust to that over a period of time. And but if you're already sick, you're gonna have big problems. If you get everything else calmed down. We've had them. How many people we have come in here who've had total hysterectomies?
Mm-hmm.
Tons.
Right.
Yeah, they do fine.
Well, and the ones that have hot flashes, I mean, we have some pretty profound results.
Yeah. By the way, the difference, and if you just sweat versus hot flashes, the sweat is your adrenal glands exclusively. The hot flashes is like the whole enchilada.
I know what you mean. Yeah.
Yeah.
The vasomotor response. Yeah.
Exactly. The vasomotor response. For those of you who listen to us on iPods or whatever it is, what is it?
Podcasts.
Podcast.
Yes, the podcast.
Sorry. And thank you. Somebody called us last week and said, thank you for giving us all this information for free. Thank you for acknowledging that it's all for free. But, we did a talk Saturday, and the reality is we've gone through a lot of this stuff. When you start throwing you got to pay for this. We've had people say, do these things, people will buy them. Well, you'll make a ton of money doing this. This is something that needs to get out. There is so much confusion out there, and it's just something that needs to happen. And if we start making it limited, if we start putting a cost on it, that type of thing, then less people are going to see it. This is a problem that started out when I was sick. And this is part of it. A lot of you who are listening to this who have these all of you who have these symptoms have a lot of the things we're talking about, or you wouldn't be having these symptoms. And this chronic pain stuff that we're seeing, when I started getting into this years ago, it was estimated that there was 50 million people out there who were suffering from, name it, chronic pain and chronic conditions. Then it was 75. Then it was 90. Then it was whatever it was. Now it's 118 million according to the latest. It's growing. It's growing. And the answer most of the time is not drugs. And we've said on everything we have ever done, we have said we're not anti-drug. We are not anti-drug. We work with medical doctors. We work with, Dr. Gates has worked with cardiologists in town, neurologists in town. We've worked with some of the big facilities here on the West Coast. We're not anti-drugs, but they are not the solution for these chronic problems. They can be part of the solution for people who maybe their physiology is too far gone and maybe it can't recover. But boy, I'll tell you what, we've seen some people who are pretty sick recover. Mm-hmm. And so I'm not sure where that line is, frankly, relative to where the physiology stops. But if the physiology stops, now it's a trade-off. If I have a rheumatoid arthritis and I'm not going to go to these guys or one of their colleagues, am I going to take steroids for the rest of my life? Same thing with hormone replacement therapy. Are you going to take hormone replacement therapy for the rest of your life? You got to really figure out, what's it mean? You want to feel crappy, or you want to take the potential of getting cancer or those types of things. And now that's actually a real trade-off at that point in time. It's quality of life versus gambling that maybe you're not one of the ones that are going to get the cancer. That's when hormone replacement therapy is legitimately on the table, but not before then. Not in our opinion, not my opinion. I won't put him in this, but not my opinion. And I've been around a while, I've been around since like 1979. So I have an opportunity to see a few people, and that's nothing could change my opinion on that. So anyway, so we're done. So any questions that you have, send to powerhealthtalk.com. We are getting a lot of such nice comments and a few not so nice comments, but the nice comments outdo the nice, not so nice ones, like by a lot. So thank you for all those nice comments. And thank you for your support and our ever-growing, whatever you want to call it, viewership. It makes it easier to do these things when, you know, people are listening, actually reading it, actually asking good questions, giving us recommendations for topics. It's really becoming fun. And if you got any recommendation or anything, send them to us, because it'll make it a lot easier on Dr. Gates, because he's picking most of these topics, and we have a full practice. He's researching at night. You know, we're always looking for better ways to do things, and to squeeze this in between all that is the easiest thing in the world. So to get that acknowledgement really is nice. So until next week, we will look for something else to talk about. I gave him a list of topics, but he's not using any of those. So
This was from that list.
I know it was mine. I know it was mine. I'm teasing you. Okay, so until next week, powerhealthtalk.com. Look us up on Facebook. Send us questions. Dr. Gates will do his best to answer them, because I know nothing about computers, and he knows all this stuff, and I don't. And we'll see you next week.
Thanks for watching.
All right.